वेलकम टू माय यूट्यूब चैनल प्रधान क्रेजी रिसर्च। प्रधान क्रेजी रिसर्च में आपकी स्वागत करता हूँ। हार्ट स्ट्रोक के लिए परेशान हूँ क्या? डोंट वरी, प्रधान क्रेजी रिसर्च लाया है आपके लिए प्रिवेंशन। स्ट्रोक की प्रिवेंशन की जानकारी के लिए आइए डायरेक्ट डॉक्टर हैबूजो के साथ चर्चा स्टूडियो में कैटी हाइन। Please see my video up to last, and if you are new here, please subscribe my channel and press bell icon.
दोस्तों, आज हम वेलकम करते हैं डॉक्टर सुंदर हाबू जी को हमारे स्टूडियो में। दोस्तों, आप जानते हैं कि हमारा आज का टॉपिक जो है स्ट्रोक के बारे में। तो स्ट्रोक के बारे में जानने के लिए डॉक्टर हाबू तैयार हैं। तो हम पूछते हैं, पहला क्वेश्चन है, स्ट्रोक क्या होता है?
Stroke means it is either a partial damage or a poor damage because of less blood supply or blood supply over blood supply because of some bleeding in the brain or something. Brain does not function properly. So that is what is called as the stroke.
डॉक्टर, स्ट्रोक का साइन सिम्टम्स क्या होता है?
Yeah. The moment a person is brought to the clinic, patient comes, either he is delirious, उसमें उसका conscious level is little bit deranged, and he may feel giddy, he may start vomiting, or his concentration will be very less. So these are all the symptoms of stroke when a patient comes into the clinic.
डॉक्टर, हमको कैसा डायग्नोसिस होगा, कि कैसा हमारा दोस्तों को मालूम पड़ेगा कि उनको स्ट्रोक आ रहा है, और स्ट्रोक आने के बाद कौन से डॉक्टर के पास लेना है?
Whenever a patient, whenever you suspect or a doctor suspects a stroke, the first thing that you cannot do anything in the case of stroke. Either he has to go to the emergency services for the CT scan or whatever it is, where because usually stroke is because of the bleeding in the brain, or maybe because of a block in the brain. So these are the common symptoms of stroke. So first thing is improve his hydration level. You just hydration level increase करो, जरा पानी की नहीं दे दो उसको. And if he is unconscious, never give water because he may aspirate and he can have a pneumonia. So best thing is check his blood pressure. Because blood pressure is one of the main causes of this stroke. So once you diagnose the patient, then you have to shift the patient as early as possible to the higher hospitals.
सो डॉक्टर, अगर किसी को स्ट्रोक आया है तो उसको कौन से फूड हमको अलाउ करना चाहिए और कौन से फूड को अलाउ नहीं करना चाहिए?
Stroke, before you talk about food or anything, first we have to discuss about what are the causes of what can cause a stroke. Important causes, first one is high blood pressure. Patient का blood pressure you have to monitor every now and then, especially after the age of 40 or 50. This is the important cause of stroke. Second thing is either high cholesterol level. It can cause a block in the brain. And third thing is either other things like that, your lack of lifestyle, lack of exercises, all these things, and even age or genetic factor. Persons who have a genetic history of stroke, they can always, the other generation also can have a stroke. So these are all the causes and aggravating factor for stroke.
And डॉक्टर, स्ट्रोक होने के लिए ऐसा कुछ एप्रोप्रिएट एज रहता है जो एज लिमिट में स्ट्रोक आ सकता है?
Before it used to be around above age of 55, 65. This was the common age to get a stroke. But nowadays, because of the lifestyle changes, because of the stress level, so the stroke can happen at any age. So usually it is very common in case of males. Even nowadays, because of the stress and all, even females are also susceptible for stroke. But usually male are the most people who are affected by the stroke.
डॉक्टर, कोई पेशेंट को अगर स्ट्रोक आया तो उसको क्या चीज अवॉइड करना चाहिए और क्या चीज करना चाहिए?
अवॉइड करना चाहिए ऐसा कुछ नहीं है. He has to change his lifestyle. First important thing is blood pressure. Monitor the blood pressure, even especially after the age of 30. Monitor the blood pressure, and blood pressure has to be always in control. If he is having blood pressure, he has to take regular blood pressure tablet. Second one is check his cholesterol levels. This is only in case of prevention. Once you have a stroke, you cannot do anything. You have to shift the patient to the hospital. Important is blood pressure, cholesterol, alcohol intake. Alcohol intake in moderation, not total alcoholism. That also can cause all these things. And fourth one is genetic factor. Okay. Yeah.
डॉक्टर, अगर किसी को स्ट्रोक हुआ
Oh.
तो जनरली कैसा मालूम हुआ कि इसको स्ट्रोक आया? सपोज कोई पेशेंट घर पे है एंड उसको कुछ चेस्ट पेन हो रहा है, सो हम कैसे डायग्नोसिस करेंगे कि इसको स्ट्रोक आया है?
Usually, normally, a layman cannot diagnose stroke. Either he has to be brought to a doctor who is nearby, and that fellow doctor can diagnose whether it is a stroke or a normal syncope. Syncope also within a certain, usually patients fall. So that is also one of the alternative diagnosis. But usually in case of stroke, patients is not in a position to recognize any persons whenever he has. And he may have severe vomiting. Severe headache is also one of the main symptoms of this stroke. And another sign and symptom is he may have fits. Patients may have some sort of a fits. So this is also one of the important signs in case of stroke.
डॉक्टर, अगर किसी को स्ट्रोक आया तो बचने का चांसेस क्या रहता है?
बचने का chances, it depends on how early the treatment is given. So the important cause in case of stroke, because of hemorrhage, chances are less. But still, patient can survive. And other things, because of other problems, patient can survive. There are 60% chances of survival. If it is because of hemorrhage, you have to be very careful.
डॉक्टर, अगर किसी को स्ट्रोक आता है, सपोज पेशेंट घर पे है, तो कौन से डॉक्टर के पास लिया तो उसका इलाज क्विकली स्टार्ट हो सकता है?
For any case of stroke, he has to go to a hospital. There is nothing like you can go to a small dispensary and you can treat the patient. It is actually first aid. Stroke, you have to give first aid and send the patients to the next hospital where the facilities are available like CT scan, MRI and all these things. So these are the things.
दोस्तों, आपको तो मालूम हुआ कि स्ट्रोक हुआ तो क्या हो सकता है, और स्ट्रोक अगर आया तो क्या प्रिवेंशन के लिए क्या हम प्रिकॉशन ले सकते हैं, आप देख चुके हैं। अगर आपको उसके हटके और कुछ क्वेश्चन करना है तो प्लीज मेरा कमेंट बॉक्स में आइए और कमेंट कीजिए। चलिए, हम डॉक्टर साहब को विदाई देते हैं हमारे स्टूडियो से। थैंक यू डॉक्टर, थैंक यू फॉर गिविंग टाइम।